Welcome to the webinar on developmentally supportive care. In this webinar, you will learn what is developmentally supportive care, why we need it, and what are the components and methods of DSC. We need to remember that the growth of the preterm brain is occurring mainly outside the uterus. The brain can be compared to the piano. What keys are pressed determine if the output from the piano is music or noise. Similarly, the outcome of the preterm brain development is determined by the experiences of the preterm neonate. These experiences are provided by the neonatal sensory system. The development of the neonatal sensory system occurs in a particular sequence. The tactile vestibular sense develops first, followed by the olfactory gustatory. The auditory and visual senses develop last. Stimulation of the early maturing senses has positive influence on the late maturing senses. Untimely stimulation within this sequence disrupts normal maturation. We therefore need to stimulate the senses in the same sequence as its development. Now, the challenge is to integrate the high technology neonatal care with sensitive, individualized approach for optimal neurobehavioral development. So, this is developmentally supportive care, providing a structured care environment which supports, encourages and guides the developmental organization of the premature or critically ill infant. In simple words, DSC is to reduce the stress of an ICU and promote a womb-like environment. Now, let us see the different methods of DSC in relation to the developing senses. For the earliest maturing tactile sense, a fine balance is sought between stimulating correctly by prone position, nesting, swaddling, facilitated tuck and massage therapy, and protection from overstimulation such as pain. Swaddling and facilitated tuck reduce pain and promote development. Massage therapy also promotes neurobehavior, weight gain, sleep, and it reduces pain, stress and hospital stay. The next question I would like to ask you is, does the newborn, especially the preterm, experience pain? The answer is a definite yes. A newborn, including a preterm, feels, responds to and even remembers pain. Exposure to repeated pain could affect the developing brain adversely. You will learn from subsequent videos in this module about the recognition of various behavioral and physiological expressions of pain in the neonate. Prevention and minimization of this pain is possible, and prevention is definitely better than treatment. Protection from pain is therefore a vital component of developmentally supportive care. After the tactile sense, the olfactory gustatory sense are the next senses to develop. Neonates greater than 32 weeks not only can smell and taste, but discriminate, remember and habituate to them. Breast milk, kangaroo mother care and non-nutritive sucking are best forms of stimulating these senses. Non-nutritive sucking reduces length of hospital stay and improves feeding. The next system to develop is the auditory system. As this is a late developing sense, the preterm needs to be protected from noise. Noise affects physiological variables, reduces sleep and increases stress. It is also associated with hearing loss and lower intelligence. Hence, it is important to do environmental and behavioral modifications to protect neonates in an ICU from noise. Music therapy may help in pacification, stabilizing vital signs, promoting feeding and sleep. Mothers singing in a soft voice to their babies help to reduce stress and stimulate appropriately. The last developing sense is vision, and the NICU can be harmful for visual development. Exposure to bright light interferes with normal endogenous brain cell activity and results in sleep deprivation. You will see in videos how a healing environment would avoid direct exposure to intense light, use point source of light for procedures and use adjustable light. A healing environment and protection of sleep are key components of developmentally supportive care. Sleep is important to promote normal brain growth. Deprivation of sleep results in neuronal death and reduced brain mass. One should therefore promote a womb-like environment to promote sleep. The best form of developmentally supportive care is kangaroo mother care. Kangaroo mother care is exceptional as it provides an appropriate balance between the understimulated tactile proprioceptive system and the overwhelmed later developing sensory modalities. With this background of the developing senses, we understand the 5 core components of developmentally supportive care are pain management, protected sleep, developmentally supportive activities of daily living, family-centered care, and providing a healing environment. We need to remember that developmentally supportive care is a continuous process and not an end. It starts right at birth of the infant. The infants are unique and display a wide variety of behaviors, and so DSC has to be individualized for the infant. In conclusion, the key messages are: developmentally supportive care reduces stress and promotes growth. It is based on the principle of sequential stimulation of the senses. Kangaroo mother care is the best form of developmentally supportive care. We should remember the 5 core components of DSC, and it has to be individualized based on infant's cues. Thank you.